Thank you, everybody, for joining us. My name is Berenice Pan with the Office of Family and Community Engagement and Education. As I mentioned before, I'm an alum. I'm a parent of, I call him Munchkin. He's in 7th grade this year, taller than me. I can't believe it. But, you know, some of the same concerns you guys have as parents, I have. So these sessions are super important for the experts to let us know what's going on. So I really appreciate everybody being here today. And today we have the amazing Dr. Fox joining us and sharing his expertise. So Dr. Fox, if you can just share a little bit about yourself for some of our people who are viewing us who might not know who you are.
Sure thing. Thank you, Bernice, and good evening, everybody. Thank you for inviting me. So I'm Dr. Fox. I'm a pediatrician, have been for over 30 years, but I'm now the Chief Health Officer of Chicago Public Schools. And what I can say, it has been the challenge of my career, that's for sure. Never a dull moment, but we're working really hard to really put the needs of kids and families first. And so I love coming to sessions like this. And I just want to say thanks for inviting me.
Thank you, Dr. Fox. And I'm going to share your deck now, so that we can get started. So we're gonna get started, guys. Give me 1 second as I share my screen one more time and present. And Dr. Fox, whenever you're ready.
All right, well, thanks again to everyone. I'm just here to share a perspective, my perspective as a pediatrician and as CPS's Chief Health Officer. I report to the Commissioner of Health for the Chicago Department of Public Health. That's Dr. Arwady, who I'm sure you've come to know over these past 18 months or so. But I prepared a couple of comments and a few slides just to frame our conversation, and then we can just launch into the Q&A. And I'm going to rely on my trusted colleague, Bernice, to run the show. And I'm just here. I will answer as many questions as I can in the time that we have, and I'm just going to do my best. I think the first thing that I want to say is that schools are safe. Schools are safe, and they're exactly where children need to be, to learn, to play, to heal, and to grow and develop, really. A key insight that we've gained over the past 18 months, which really, I'd have to say, is grounded in public health. You follow me? It's supported by science. That's where we try to be. The point is this: every child needs the opportunity to learn in person. And we know for a fact that we can make that happen safely. That's really what the work is about. Now, the way that you do this safely is to wrap yourself in many, many layers of protection. That's the strategy that we're taking and that we've really invested in at Chicago Public Schools. And this list right here, this is a list of all the different layers, or many of the different layers, the most important layers, I would say, in providing that protection. What I'm talking about is universal masking. Like if you're in a CPS school, you're wearing a cloth face covering. Everybody does, vaccinated or not, everybody wears the mask. So universal masking, social distancing. Right now, social distancing, that means 3 feet between students. We want clean hands. We want people to stay home when they're sick. We work toward cleaned and disinfected spaces. A huge investment on the facilities part of things to make sure that that's so. Appropriate ventilation, another important facilities function. There's COVID-19 testing in the schools. There's contact tracing. And the point of that is to put the cases of COVID in isolation away from everybody else. You're keeping the sick away from the healthy. and you're putting the people who are not vaccinated, but who are the direct contacts of a known case, we want to put them into quarantine. So I'm talking about two important words here, which I'm sure you're all familiar with by now, but let me just call them out. You isolate the case and you put the direct contacts in a quarantine. That's two different things. Okay? Cohorting, which just means organizing people in a school so that they're not just randomly mingling, haphazardly. We know where people are and who they were with. That's really what cohorting is. Care rooms, you may have heard about. So a care room is just like a temporary space. It's staffed by a person who's trained. And it's where kids go until their parents pick them up if they need to be discharged early from school. Let's say they become ill during the school day. Well, we want those kids away from the healthy kids until their parents pick them up. And where they wait is called a care room. Okay? It's not a nursing office. It's not an instructional space. It's just a safe place where kids wait until their parents come and pick them up. And it's supervised in a particular way. So care rooms. And then finally, just you'll see if you walk into a school, there's signs everywhere just to remind people, here are all these safety things that we have to do right now because we're living in a pandemic. It's totally different than just the normal beginning of school. So there's signs all over the school that remind people of all these different layers of protection and what they need to be doing to making good use of them, the ones that are in their control, for example, like masking, distancing, cleaning their hands, etc. All right. So these are the effective layers of protection. We've had these layers in the past, okay? There were a couple of layers that we had last year that we don't have anymore. The one that I'll point out is temperature checks. You'll notice we don't do that anymore because what we found out is that that doesn't protect anybody. It's not a layer of protection, it's just extra work. So we got rid of it. Anyway, we've talked about the layers that remain. There are many of them, as you can see. That's that. There's another important layer of protection, though, that we haven't talked about yet that I really want to highlight this evening. It's really depicted in this slide. This layer is COVID-19 protection, COVID-19 vaccine protection, okay? The message is this: every eligible person should receive a COVID-19 vaccine. There are 3 different FDA-approved options. That's the Pfizer, Moderna, and the J&J. Okay? So there are the 3 approved vaccines. These vaccines are safe, they work extremely well, and they are widely available now, which wasn't always the case. You'll remember back in February, different story. Very difficult story, but we're in a different place now. Fortunately, there's a vaccine everywhere. The key thing is get it in the right place, which is in somebody's arm. So the vaccines are safe, they work extremely well, they're widely available. They are free of charge, and they're offered with no proof of insurance or citizenship required. It's important to note that people 12 and older are approved by the FDA to receive COVID vaccine. The one for 12 and up is the Pfizer one for right now, but that's going to change soon. There will be more options there. But anyway, the point is people 12 and up are eligible for vaccine, and people 12 and up should get this vaccine today or as soon as possible. All right. Also, to support the safe return of our students to our classrooms, we are requiring that all staff be vaccinated. unless they qualify for a medical or religious exemption, as it's called. Okay, every person working in a school for CPS must submit proof of their vaccination status by October 15th. And this new policy, it just adds another layer of protection to the many that are already in place. What's the best way to protect children under 12? The ones who are too young to be eligible for the vaccine. Well, it's by surrounding them with other people who are fully vaccinated, as well as making good use of all the other effective layers of protection that we've discussed. Okay, so we had all those layers. Here's another really important one. I'm highlighting vaccine, COVID vaccine as another important layer. Next slide, please. Okay, now, as of August 29th, almost 60% of Chicagoans aged 12 to 17 have gotten at least one dose of the COVID-19 vaccine. Okay, I wish it was 100%. I'm gonna keep on pressing till it is, but that's where we are right now. Okay, we have at CPS partnered with the Chicago Department of Public Health and a broad network of healthcare providers to increase access to the COVID-19 vaccine for our students and their families. Okay, in many ways. I'm just going to mention 4 of those ways. The first is literally, there are hundreds of mobile vaccine opportunities at CPS. Okay, these are mobile events at schools. We've been working on them since July. These are the student and family ones. We did the staff back in February through June, but now we're focusing on students and their families. But there are many mobile opportunities that exist. We started with that part of it in July, and these are scheduled through November. We haven't extended the schedule beyond that, but we'll do that soon. So that's one option. Okay, second, there are 4, we would call them regional vaccination clinics that have been set up for the purpose of providing access to the COVID vaccine for families. These are at Chicago Vocational Career Academy, Roosevelt High School, Michelle Clark High School, and now there's a 4th at Richards High School. That one's opening tomorrow. The other 3, those are where we did all of the staff ones. So they've been open, operating for months. Now we've switched them up. Now they're for families and students. We added Richards as a 4th. So there's the mobile events at schools. There are regional clinics run by CPS. Okay, we have school-based health clinics, school-based health centers in the district as well. There are 34 of them. 8 of those do offer the COVID-19 vaccine, the Pfizer one in particular, so that the young people can get it. You can get appointments for this. Actually, they take walk-ins too. All right. And so that's going on. That's going on as well. You can find a vaccine as shown in the slide. No, I'm sorry. Yes, here, you can get information about the school-based health centers by going to schoolinfo.cps.edu/health-centers. Yes, that's what the point I wanted to make there. We also make opportunities available at the back-to-school bashes, and you can find other vaccination opportunities, by clicking on the link to the slide. You can text your zip code to this number 438-829, and you get back, where the vaccine opportunities are close to your zip code. Or you can call the number that's here, 312-746-4835. That's Chicago Department of Public Health. That's the COVID-19 hotline. Okay, you can even get the vaccine delivered to your home. Okay, it's like Uber Vax or whatever. You know what I mean? It's not called that, obviously. But through the Chicago Department of Health, they'll come to your home. and do it. So I guess the point I'm really just trying to drive home is this vaccine is widely available. We want people to take advantage of that. We have invested in major mass marketing and communications campaigns, to reach a broad audience. At our vaccination events, you may, if you were at any of them, you would see there are all kinds of incentives. We're trying to make it more, fun. Gift cards, backpacks with school supplies, food, family activities, etc. But here's the thing. Right now, our capacity to deliver the vaccine, is much, much greater than the current demand for the vaccine among the families of those with children 12 to 17. Okay. In other words, there are many, many, many more slots, open slots for the COVID shots than we have people stepping up to get the shot for themselves and for their children. However, parents are in a great position to do something about that. And I urge you to find and fill a spot to get the shot for yourself and for your eligible children 12 up. We can go to the next slide, please. Okay. I put this here because I want to have a serious conversation. Okay? And my point right here is this. At least part of the reason for whatever vaccine hesitancy there is may have to do with how COVID-19 vaccine is covered in the media. That's part of the story here. This photograph is of Mark Bernier, God rest his soul, who used his power in the media as a popular Florida radio talk show host to convince people not to get the COVID vaccine. You follow me? He used his media voice, and it was a loud voice, to compare those who would mandate or advocate COVID-19 vaccination, compared us to Nazis. He said a lot of things about COVID-19 vaccine that were not true. They were not based on public health or science. He said a lot of things about COVID-19 vaccine before he himself succumbed to COVID-19. This was just a few days ago, August 29th. And he got it because he was not vaccinated. This is a tragic story. This is a tragic story. All human suffering grieves me. It does. I mean, that's me as a doctor, that's me as a human being. But it's even more painful because a lot of people took Mark Bernier, they took his word as the gospel, which places them in grave danger, just as it did for him. Fortunately, there are many reliable sources of information about COVID-19 vaccine out there. Next slide, please. This is one example. If we can show it. Yeah, thank you. This is one example of a reliable source of information about the vaccine. This is from the Kaiser Family Foundation. It showcases the expertise of doctors and healthcare workers on the topic of COVID-19 vaccine. Let's go to the next slide, please. Here is another reliable local source of information about COVID-19 vaccines is from the Chicago Department of Public Health. Let's go one more. Next slide, please. Here's another reliable source of information. This is a still from a public service announcement by Barack and Michelle Obama getting their COVID-19 vaccines. There are many examples of this. What I'm saying is that I stand with them and with other doctors and CDPH and Barack and Michelle Obama, and we're urging all people, all eligible people, and all eligible Chicagoans to please get the COVID-19 vaccine. Do it for yourself, for those you know and love, to protect, to prevent severe illness and to save lives. Don't wait, vaccinate. That's the message. I'm going to close right here so we can get to some questions. I do want to urge everyone to get the very best information that you can get from the experts. Pursue this task as if your life depended on it, because you know what? It does depend on it. That is the reality of how we live now in the age of pandemic. So let me just wrap it up right there. I think we have quite a bit of time. We've got a nice intimate crowd here, so I hope we can get to everybody's questions.
Yeah, for sure.
But let me turn it over right now to Bernice.
Thank you, Dr. Fox. I'm going to stop sharing my screen. And yeah, we actually got some questions ahead of time, and I know we do have some questions in the Q&A. Maria, I do see your hand up. We are using the Q&A function, so if you have a question or a comment, please put it on the Q&A, and then I'll voice it over. Okay, so the first question I want to ask is from a mom who submitted a question ahead of time, and she has a high schooler who's on the swim team. Who has to take swim class at school.
Swim class.
Yeah, so they are concerned about going in the water with someone who might possibly have COVID. Like, is it spread to water? Can germs get in there? Can he get it while he's swimming? Right. That's our concern.
Yeah, that's a great question. I would say you just stick with the fundamentals, right? The way that this is spread is by respiratory means, okay? Respiratory droplets of a certain size in the air. It goes from an infected person's, mucous membranes, their nose, their mouth, their eyes. Okay. Mostly we're talking nose and mouth. And the droplets go out, and then they get onto the nose, mouth, or eyes of a person who's within 6 feet distance. I'm talking about you standing out. You're standing out in the world. You know what I mean? Mm-hmm. You're within 6 feet for 15 minutes or more. That's in a 24-hour period. During the person's contagious period. That's how it's transmitted, okay, by respiratory means, certain small droplets in the air, not through the water. Now, there are other germs that are clearly passed through water, okay? Hepatitis A, a bunch of different ones. We don't need to get into the long list, but this isn't one of them, okay? So it's actually fine for kids to, take that swim class. People still need to learn how to swim. That's an important safety thing. And it's a safe thing. It's a safe thing to do, even in the age of pandemic. Now, before they even got to the pool area for their class, they're still wrapped in the layers of protection, okay? All those things we talked about, they have to be in force, you know? But swim class is just like any other class. It's safe to do with the right layers of protection in place. So I wouldn't have any special concerns about, being in swim class or taking swim class now, as long as everybody's following the overall rules for how we do school now.
For sure. No, thank you, Dr. Fox, for that. And I think that leads to the question that Ricarda has posted for us, right? I guess she's been to the school when they're dropping off and picking up the kiddos, I'm assuming, right? And she's not seeing that social distance between the munchkins.
Right.
So she's raising that concern, like, how is that safe? How can we trust that this is happening?
Right. Well, the thing is, like, you have to be, like, times of transition, drop off and pick up, okay? That's a special circumstance. Mostly through the school day, kids are organized in a specific way in a cohort. They're in their classroom. They're measured distance apart, okay? But in transitions, when people are exiting the building, there's a certain amount of congestion that's going to happen. And that's okay. Nobody's getting COVID by passing by somebody in a hallway or encountering them for a few seconds or really even minutes as they're making their way out of the building into their parents' arms. Nobody's getting COVID like that. But you can rest assured when they're in the building, they got their mask on, their social distancing, there are all these other layers. That's what's happening. That's what's up during the school day. When kids are, dismissed, we really are working with the schools to make that dismissal process really different than it used to be. It used to be much more wild than it is. We work with the schools. We want it to happen in an organized, orderly fashion, but kids are kids. And there's going to be a little bit of congestion that happens, but that's okay because it's a brief thing. It's in passing and it doesn't represent what's happening through the bulk of the school day.
Yeah, and Ricardo, just to on what Dr. Fox was saying, I know all of us at central office got sent to schools this week to support the schools with the munchkins coming in. So I was, when one of the elementary schools where we had our pre-K kids who were crying because they didn't want to leave their mom. So it was a little chaotic, right? So we totally get that. And I know the staff, myself, and some of the other central office folks try our best to do just what Dr. Fox said, right? Like separate them, make sure the kiddos were okay. I had to grab a young lady and carry her in because she just didn't want to go in. And mom was like, help me, so we know that those things happen, but she had a mask on, mom had a mask on, I had my mask on, and we were able to transition her into school. I can give you another example of my son. I know his school's a little bit bigger, about 500 kids, and they did kind of like a staggering and use the different doors in the building, right? So like 7th, 8th grade start they all have to start at 8:30, but they started letting them in at different times and through different doors so that they understood that they had to stay in line, do all the stuff, knowing fully that, like Dr. Fox says, some kids are kids and they're going to want to run around. But it's also a conversation that I had with my 7th grader, right? Like, I know there's peer pressure. Make sure you keep your mask on. Make sure you're doing this. And of course, my preteen's like, I know, Mom. Right. But I was like, I just want you to be safe. So I think we are going to see some of the stuff. I had that first experience with the school I was supporting where the teachers and the staff and the principal and the AP were out there really telling people to, stay in line, kids face this way. So it is a learning process, and the principal was so awesome to take me and other colleagues into the classroom to see the kids and learning and how they're separated. So it is working. I think they're trying obviously their best. The kids all had their mask on, which I was super impressed. I was like, all right. And they had awesome masks. I was wearing a Harry Potter one and kids were super excited about it. So I think making it fun, right? Like the healthy part of it, making it fun, the kids totally know and learn and understand. So I think this first week for all schools, I think it's a little chaotic at the beginning, at the end of it, once kids get in that rhythm. So Ricardo, I will say for your school, talk to your principal, see what's being put in place, see if you can visit or support yourself and how you can help them, something like that. Send me an email if you have more questions and we'll try to answer them. So thank you, Ricardo, for that comment and statement. I do have another question from Maria, and she wants to know, I think what all parents of kids under 12 want to know, when is a vaccination going to be available for her 7-year-old?
Right, that's a great question. Honestly, I have to say, I don't know with certainty. What I have heard, from people who are kind of in the know, by the end of the year, this year, I'm talking about this calendar year, the major manufacturers are going to have their documentation in place and their applications in place for the review process at the Centers for Disease Control and Prevention and the FDA to evaluate that. It has taken a minute to get those safety and those studies done that say for children under 12, can we say with certainty it's safe, it works, we know what the right dose is, because it could be different than what is necessary for those 12 and older.
For sure.
And are there any special things around how you deliver it, like the space in between the doses? Is there anything different about that? People have been really working hard to study that and make sure that we can say with certainty, this is safe and it's ready to go through the evaluation process. People are being extremely careful. I mean, they were extremely careful first go around with adults, but this is pretty typical for vaccines, that when we're doing the pediatric studies, there are even more questions. And so it does often, I'm going to say typically, it takes longer to get an approval for a pediatric vaccine. Fortunately, people know how to do this. Obviously, if you've seen what the vaccine schedule is for pediatrics, it's extremely complicated, very busy. There's a lot of different vaccines. You know what I mean? So we've been through this before. Pediatricians are very, very familiar with delivering vaccines. This is a very special one we're talking about right now. But we're going to get there. What I'm hearing is that probably by the end of the end of the fall, the end of this calendar year, the materials will be in the hands of the people who would be making the decision. And so I think that's where we're at.
Yeah. So Maria, to your question, Dr. Fox, remember it's the calendar year, so December, right? Not the school year.
Right.
Are like the whole year. No, it's the calendar year, so December going into January 2022, not the school year.
Thank you for that clarification.
Yeah,
exactly what I meant.
For sure. Yeah, and something I know. As a parent, I know you guys are also worried. Mom talked about the swim class. Sports is another thing. And this is, as a parent, my munchkin, I know he's not a munchkin, but my munchkin is in, I put him in sports this year, outdoor, right? It was track and field or cross country, sorry, that he's running. And I did get an email from the coach with the CPS instructions that, he has to be vaccinated. If he's not vaccinated, they need to be tested once a week. Right. So as a parent, I was like, this is awesome. This is great. They're giving me information exactly of what it is that my kid needs to be doing and who he's going to be around. So I know that either one, they're vaccinated, or two, they're going to be tested. So I'm still a little, right, as a parent, and my kid is vaccinated. He's 12 years old. But it's still, I know for parents, right, it's still that question in your head. But at least, like Dr. Fox said, right, there's those layers where I know they're wearing masks. Most of those kids I know are vaccinated because I talk to their parents, right?
Yes.
And for those that are not, they should be tested. So I
That's
think
right.
as a community, that's something to encourage you guys to talk to your community, right? Like if my kid has been with the same class since kindergarten. So I feel comfortable enough to talk to the other parents and talk about vaccinations and see what's going on. And they feel comfortable with us. So it's truly a community. So I encourage parents, right? Don't be like nosy, like, did you get vaccinated? Right. But if you have that comfort with that community, absolutely, like have that frank conversation, right? Because, my something my seventh grader said after his first day of school was like, Mom, it felt almost normal. And I was like, good for you. Like he just had a really good day at school. And my husband and I were terrified, but he was like, it felt almost normal. Like I had so much fun in school and seeing my friends. And so I feel good about that. And just like many of you guys who are joining us today, even though I work for CPS, my fear is still there as a parent, right? It's just human nature. But I'm happy to say his school is doing awesome. He's having fun, and I think he's safe doing sports and being in school and doing recess. So I really appreciate like all those layers you talk about, Dr.
Yes. Thank you for that story too. I love hearing it because I think that's the reality for most of the kids who are back. I think that's what it is. And the other thing I would just add is one big advantage of the cross country sport. It's outdoors. We were worried much less about outdoor activities than indoor. Totally different situation. So
for sure,
that's
why I signed him up for that.
That's a good one. Good choice. Good choice. And it's a little bit more individualized. It's not like, you're like in somebody's face constantly.
Right. It's a sports, but individual sports.
Yeah. I think that's the one I would choose.
There you go. And that's what we did.
Yeah.
Thank you for that. And parents, share your stories with us too. If you have kids who are having concerns, issues, email me, let us know what's going on so we can best support you. One of the other things that I want to ask you, Dr. Fox, I know we had this in some of the other sessions where parents were talking about, you talked about that period where they are contagious. And then when they're taking their test to see if they're COVID, can you explain that a little bit more? Because I know that's a lot of concern for parents and sometimes confusing as to when they're contagious, when do we get tested, how do we know?
Right. Okay, let me just try to keep me on track. And I don't want to go off on too much of a tangent or go down the rabbit hole too much. But a person is contagious. And this is one of the hard things about this virus. You're contagious. Let's say you have COVID. You're contagious even before you have any symptoms. 2 days before you have your first symptom. That's when your contagious period begins. And your contagious period goes for 10 days after the start of your first symptom. That's why the isolation period is 10 days. As we know, your body clears the virus after 10 days if you have the illness. So let's say your case, you're contagious even before you were sick, which is part of what makes this so hard because, I felt well, I was at school. Then I found out that I have COVID. Okay, but I already exposed those people 2 days before I ever had my first symptom. What makes it so tricky? And your contagious period lasts all the way until basically 10 days after your first day of symptoms. Okay.
Yeah.
Now the quarantine period is different. Remember, we were talking about isolation versus quarantine. Now, quarantine, you go into quarantine if you were a close contact of a known case. Okay, let's say somebody was a case, you were, you were at a party with them and dance with them or something like that, whatever. Okay, if that happened during the person's contagious period, then you would be considered a close contact of a known case, and your symptoms from that exposure could happen at any time for 14 days after the last time you were with that person. Okay, it could be at any time. It could be, usually it's a couple days after you were, typically, but it could be at any time. Okay, up to 14 days after you were last with the person. That's why the quarantine period is 14 days, because the germ can be in your body, growing, we say incubating, for 14 days before it ever really shows up in you as a symptom. So there's isolation and there's quarantine.
Got it. Thank you. And I know it's super difficult. Sometimes it's hard for even myself to wrap around it. And you and Ellie have explained it many times that I'm so like, what is it? So no, totally get that. And thank you for explaining that. I know some of the other questions parents had wasn't clear for them. And we talked about this, like after, you're in quarantine or isolation and you take a test and you're clear, sometimes those tests come back as positive. Right. And I know Ali explained a little bit of how the virus works and the particles that stay in your body. So can you explain that a little bit so parents can get it again?
Okay. Let me just make sure that I got the question right, that you want to know more about, like when it shows up. Is that what the question is?
Right. So like I had COVID. I quarantine. I did what I was supposed to do. I go get tested again, but my test still says it's
right. Okay. Yeah. Okay. So here's the thing. Once you know you have COVID, we know how long it takes for you to get rid of it. You don't need to get retested to make sure that it's gone. Don't bother. What we know is how long it takes for your body to get rid of it to, enough of an extent that you're not a risk to any other person. That's 10 days. It happens to be the case that even weeks after you had and cleared your infection, and even months after you've cleared your infection, you're not contagious to anybody else. It's not causing you any problem. You got over it. However, little bits and pieces of broken down genetic material of the virus may still be present on your nose or your throat. And if you tested yourself, if you got a test, a certain kind of test, like an antigen test or even a viral test, you might recover some of those bits and pieces, and it would look like, yeah, you have COVID, but you already knew you had it. So you don't get retested to make sure that it's clear. We know that you're over it after 10 days. Your contagious period is over, even if there's little bits and pieces of genetic material still present that's not causing any harm to anybody, and it's not transmitting the virus. It's really the whole virus that matters, not the little bits and pieces of it, which could still be present for a long time, even after you've recovered. So we say you don't need to get tested, after you already have a diagnosis. Okay. We do say, let's say, if you are a close contact of a known case, you're going in a quarantine, 3 to 5 days after you're in quarantine, you should get tested to find out, did the germ come to me from that exposure that I had. So people who are in quarantine should get tested. Okay. However, here's a tricky piece. A negative test, let's say you were exposed, you got put in, you're in a quarantine, which means you really don't leave your house except for medical care. You go and get some medical care to get a test to find out what was there a consequence of you being in contact with somebody who had it. It may be positive, in which case now you're a case and you go through you're put in isolation, not quarantine. Okay. You might get tested on somewhere in days 3 to 5. Your test might be negative. However, that does not release you from quarantine. We can't say, oh, your test was negative, no problem, don't worry about it. Okay. Because the virus could still be incubating, just hadn't grown to a certain level enough to be recovered on the test. You have to stay in quarantine even if your test was negative. Once you're in quarantine, you're in quarantine. A negative test does not get you out of quarantine.
Thank you, Dr. Frost. I think that's clear, because I think that was sometimes confusing for some of the folks that joined us today. And
it
before,
is tricky.
Like when I take a test, can I, it's negative, can I just go out again to the world? So thank you for clarifying that.
Yep.
Thank you.
It's tricky, but I think those are the basic things to
Sure. For sure. And I think we're going to close it up. So I just wanted to get your thoughts and like, I know you mentioned a lot about vaccine. From everything we talked about, we gave a lot of really good info. What is the major thing you want parents to leave and share with other people? We want this information to be shared that you want them to share out.
Okay. First, get the best information you can possibly get. There's a lot of mess out there. Ask an expert. It doesn't need to be me. I'll give you all the links you want for the reliable places. I would go with the ones that we were talking about. Those are excellent places to start. But get the best information that you can get. If there's anything else I want people to remember, there are many, many layers of protection we have in place. If one thing isn't working well or the virus finds a way around it, there's another layer and another layer and another layer and so on. So there are many, many layers. One of the most important layers is the vaccine. That's it right there. 12 and up, you're eligible. Get that vaccine. And you're protected. I mean, we know, 99% of the cases now in the hospital or dying of COVID are among unvaccinated people. That tells you something important right there. The vaccine is safe, it works, it's widely available. Something like 170 million people have been vaccinated now in the US alone. Can breakthrough infections occur? Yes, they're rare. Fortunately, that's why I'm saying the vaccine works extremely well. Is it perfect? Is it 100%? No. We know there are breakthrough infections. I don't want to get too far down the road on this, but basically, get the best information you can get. Know that there are many, many layers. Use them all. The most important one is a vaccine. Get that vaccine if you can get it. If you're eligible, do it. Be on the lookout for when it becomes available for kids under 12. We're going to be working hard to get them vaccinated too. That's it.
Yeah. Thank you, Dr. Fox. No, thank you for that. And thank you for all the parents who join us today. Thank you to our interpreters. Shout out for them. They're always so awesome and interpreting what we're saying to Spanish. I know we have Mandarin for some of our other sessions, so thank you so much. Dr. Fox, as always, a pleasure to be in a
Thank
meeting with you.
you. Pleasure to
Absolutely.
be here. Thank you for inviting me.
Absolutely. And to everybody, have a great night, and we'll see you at the next As the Expert session. Thank you so much, everybody. Have a good night. Bye-bye.
Bye.